The first alarm went off soft. Not the screaming kind, just a single sharp tone from the cardiac monitor that made every trained body in the room stiffen. Then another, and another. Within seconds, the VIP medical wing of Sentinel Military Hospital erupted. Vitals dropping. Lock the corridor, now. Where the hell is anesthesia? Steel doors slammed shut as armed military police sealed the hallway. Red emergency lights strobed against white walls. A trauma pager shrieked code black, priority 1. On the operating table lay General Marcus Hale, 4-star commander, architect of 3 classified operations, a man whose signature could start or stop wars. Blood soaked through the sterile sheets beneath him. BP's 70 systolic, a nurse shouted. Heart rate 140 and irregular. Dr. Victor Klein, chief of medicine, stood at the foot of the bed, his hands hovering uselessly over the patient's chest. Sweat beaded at his temples, though the room was freezing. This doesn't make sense, he muttered. We stabilized him. A young resident glanced at the monitor, her voice cracked. We are losing him. The doors burst open again, this time not doctors, but uniforms. A colonel, 2 federal security officers, a hospital administrator who looked like he might faint. The colonel leaned in, General Hale's condition. Klein swallowed, critical, we're doing everything. The heart monitor screamed. Flatlined, then staggered back into a weak, chaotic rhythm. Someone started compressions. Clear. Thump. The general's body jolted. Nothing. Again. Thump. Still nothing. Then, impossibly, the general gasped. His eyes fluttered open. The room froze. Every hand stopped, every voice died. The most powerful man in the building looked past them. Not at the chief of medicine. Not at the officers. Not at the machines keeping him alive. His gaze locked on something distant, something remembered. Klein leaned in, desperate. Sir, General Hale, can you hear me? The general's lips trembled. His voice was barely air. Don't let him. Klein exhaled in relief. Yes, sir, I'm right here. The general's eyes hardened. No, he whispered. The word sliced through the room. He gathered what little strength he had left, turned his head slightly, and spoke the sentence that would detonate everything. Get me the nurse, they fired. Silence. No one moved. The colonel stiffened. The administrator paled. Klein felt the blood drain from his face. That's not possible, Klein said quickly. Sir, she's no longer employed here. We have the best specialists in the country. The general's eyes snapped back to him. Pure clarity. Pure authority. I don't want you, he whispered. The monitor dipped again, dangerously low. Find her, the general rasped. Now. Then his head fell back. The alarms exploded all at once. Cardiac arrest. Resume compressions. Prepare for emergency intubation. But the damage was done. Because in that single sentence, power shifted. Phones came out. Names were searched. Old personnel files were pulled from buried archives. A nurse. Fired. Erased. Dr. Victor Klein stepped back, as if the floor had dropped away beneath him. The colonel turned sharply. Who is she? No one answered. Because everyone in that room suddenly understood the same terrifying truth. They had humiliated the wrong person. And somewhere outside those locked doors, the one person who could save the general had no idea the past was about to come roaring back. 18 months earlier, the trauma bay smelled like antiseptic and hot metal. Blood pooled on the floor beneath the gurney, slipping under the wheels as orderlies rushed in and out. A young soldier lay motionless, chest rising unevenly, his uniform shredded by shrapnel. "Name, Private Daniel Ross," a medic shouted. "IED blast, multiple fragments, vitals unstable." Nurse Elena Ward was already at his side. She didn't ask permission, she never needed to. "Pressure's falling," she said calmly. "He's bleeding internally." A monitor beeped erratically, oxygen saturation dipped. His skin had gone ashen, that color Elena recognized too well. She'd seen it overseas. "Prep for massive transfusion," she ordered. "O negative, rapid infuser." A resident hesitated. "CT hasn't cleared yet." Elena turned, eyes sharp. "He won't survive the scan." That was when Dr. Victor Klein entered. Chief of Medicine, immaculate scrubs, perfect hair, a reputation built more on politics than patience. "What's going on here?" Klein asked, already annoyed. Elena didn't look up. "Suspected internal hemorrhage. We need blood now." Klein checked the chart, then the clock on the wall. "Protocol requires imaging confirmation," he said flatly. "CT is delayed 10 minutes. Elena finally faced him. 10 minutes is fatal. Klein's jaw tightened. "You don't make that call." "I do when the patient's dying." A hush fell over the room. A nurse glanced between them. The resident held his breath. Klein stepped closer. "You are a nurse, I am the attending physician. Follow procedure." Elena looked at the soldier's face, so young, so pale. She remembered another one just like him. Another bay, another delay. He hadn't made it. "Document it however you want," she said. "I'm not letting him bleed out." She turned and grabbed the blood line herself. "Stop," Klein snapped. Elena spiked the bag. The rapid infuser whirred to life. The soldier's pulse stabilized, just barely. Color crept back into his lips. A collective exhale swept the room. For 5 seconds, no one spoke. Then Klein exploded. "What you just did," he said loudly, "was insubordination." Elena didn't flinch. "It was medicine. You violated chain of command." "I saved his life." Klein turned to the room, everyone out. Later that morning, Elena stood outside a glass office overlooking the hospital courtyard. 2 administrators sat inside. Klein stood between them. No chair was offered. "You bypassed established protocol," one administrator said. "Protocol would have killed him." Klein's voice cut in sharp. "This isn't about the patient, this is about authority." Elena felt it then. The decision had already been made. "This hospital does not tolerate rogue behavior," the administrator continued. "You're terminated effective immediately." Elena blinked. "You're firing me for saving a soldier." "For disobeying orders." They slid a letter across the desk. "Termination. License suspension pending review. Internal blacklist recommendation." Elena didn't beg. She just nodded once. As she walked out, staff lined the hallway pretending not to look at her. One whispered, "She thinks she knows better than doctors." Another said, "Good riddance." By nightfall, her access was revoked, her credentials erased. The soldier survived. Her name didn't appear anywhere in his file. That evening, Elena sat alone in her apartment, uniform folded on the table. She stared at her hands, still steady, still capable, still willing. But the system had decided something else. And somewhere, far above her, Dr. Victor Klein added another quiet victory to his career. The first night, Elena slept in her car. It rained. Not hard. Just enough to seep through the cracked window seal and drip onto the dashboard in slow, mocking taps. She sat in the driver's seat, uniform folded beside her like a memory she wasn't allowed to touch anymore. 18 years of training. Combat deployments. Lives saved in places without names. Reduced to a termination letter and silence. Hospitals didn't return her calls. Clinics suddenly filled their positions. Her license wasn't revoked, but it was flagged. That was enough. Elena learned quickly how invisible competence could become. She took a job cleaning floors at night in a low-income medical clinic on the edge of the city. Janitorial badge. No scrubs. No respect. During her first shift, a teenager collapsed in the waiting room. Staff froze. Elena dropped the mop and moved without thinking. "Lay him flat," she said. "He's hypoglycemic." A nurse hesitated. "Who are you?" Elena was already checking pupils. "Juice, now." The boy came around minutes later. No one's thanked her. The supervisor warned her, "Stick to your job." She did. Mostly. She patched up a knife wound in the bathroom with butterfly strips she paid for herself. She taught a single mother how to manage asthma attacks using a phone timer and calm breathing. She stayed quiet. Still professional. Still honorable. Just unseen. At night, she listened to ambulance sirens and felt something hollow ache in her chest. Not anger. Loss. One evening, she found a free clinic run by a retired paramedic. He watched her work for 10 minutes and said, "You've done this before." She nodded. He didn't ask where. The clinic paid in cash, barely enough. But people lived. Elena slept on a borrowed couch, then her car again, then a storage unit when the rain got worse. She kept her hands steady. She kept her standards. She never once said Dr. Klein's name. Across town, his face appeared on hospital newsletters. Excellence in leadership. Protocol saves lives. Elena didn't read them. She was busy holding pressure on a gunshot wound with no gloves and a prayer. One night, an elderly veteran grabbed her wrist. "You military?" he asked. "No," she said. He smiled weakly. "You move like one." That night, her phone buzzed. Unknown number. She ignored it. It buzzed again. Then a third time. She silenced it and went back to work. Because people like her didn't get calls like that anymore. She was wrong. The phone buzzed again. Elena glanced at the screen this time. Unknown caller, priority. She frowned. No one labeled calls like that. She answered. "Yes." A man's voice, controlled, military. "Nurse Elena Ward." Her spine straightened, speaking. "This is Colonel Andrew Reyes. You are requested at Sentinel Military Hospital immediately." Requested. Not invited. "I don't work there anymore," Elena said evenly. A pause, then quieter. "The general asked for you." That did it. "What general?" "Marcus Hale." The name landed heavy. Elena closed her eyes for half a second. "I'm not cleared." "You are now." Across the city, the VIP wing was under lockdown. Dr. Victor Klein paced like a trapped animal. "Find her," he snapped into his phone. "Offer money, authority, anything." No one responded. A federal medical liaison stepped in. "Doctor, you no longer have sole authority over this case." Klein spun. "This is my hospital. It's not your patient anymore." Back at the clinic, a black SUV idled outside. Two uniformed MPs stood by the door. No sirens, no drama. Just inevitability. Inside the hospital, Elena felt eyes on her as she walked in wearing borrowed scrubs. No badge. No title. Still, people moved out of her way. She reached the trauma bay and stopped. General Hale lay pale, ventilated, surrounded by machines. Elena didn't rush. She observed. Chest rise. Monitor rhythm. Fluid balance. Then she spoke. Who managed his airway? A resident swallowed. I did. Tube depth. 22 centimeters. She adjusted it 2 centimeters deeper. Oxygen saturation climbed. Klein stepped forward. You don't have authority here. Elena didn't look at him. Stop vasopressin, she said. Start norepinephrine, he's preload depleted. The anesthesiologist hesitated, then obeyed. Klein's face reddened. This is unacceptable. General Hales stirred. His eyes opened. He looked at Elena and nodded. That's her, he whispered. The room froze. Elena leaned close. I'm here. His grip was weak, but intentional. Don't let him decide, Hale murmured. Elena straightened. Prep OR, she said. Now. A surgeon stepped forward. On it. Klein raised his voice. I am chief of medicine. The colonel stepped between them. Not right now. For the first time in his career, Dr. Victor Klein was ignored. Elena walked with the gurney, calling vitals, correcting mistakes before they happened. She wasn't angry. She was focused. Because this wasn't about revenge. It was about survival. And for the first time since she'd been fired, she was exactly where she belonged. Elena stood over the general, hands steady, eyes scanning the monitors. Every beep, every flicker of the screen told her a story. BP 72 over 48, she muttered. Map dangerously low. Initiate fluid bolus, 1000 cc crystalloid. Slow push, monitor for pulmonary edema. A resident hesitated. Crystalloid, shouldn't we start blood products first? Elena didn't look up. Map too low, perfusion to the brain takes priority. We'll follow with packed RBCs once stabilized. You're compressing the aorta if it drops below 60, right? The resident nodded, finally moving. Good, Elena said. Now attach arterial line. I want real-time pressure readings, no estimates. She moved to the ventilator. Oxygen saturation is plateauing at 88%. FiO2 at 100%. We need PEEP increased. Set to 12. Watch for barotrauma. The anesthesiologist flinched. This is high, could cause pneumothorax. Risk of hypoxia exceeds risk of barotrauma, she replied calmly. Check tracheal tube depth, 24 centimeters, too shallow, advance 2 centimeters, confirm with end tidal CO2, now. The general coughed softly as the tube repositioned. Saturation climbed. Elena, Klein said, I am the attending physician here, you. She interrupted, Doctor, this is not a debate, follow my commands or step aside, stat. A murmur ran through the room. Nurses, residents, even surgeons hesitated. No one challenged her again. Elena's eyes flicked to the monitors. Trend hematocrit, we are losing blood into the pleural space. Thoracostomy indicated. Clamp ready. Make sure the suction is primed to 20 mmHg. Rapid sequence. She pointed at a resident. Scalpel chest tube right side. Mid-axillary, 5th intercostal space. Local infiltration, lidocaine 2% 10 cc. We can't wait for full or prep. Klein tried to speak. Excuse me. Silence, Elena said. Monitor vitals every 30 seconds. Draw ABG. I want potassium, lactate, and hemoglobin immediately. Do it. The surgical team moved as if guided by instinct, but it was Elena's instinct. Years of battlefield medicine, years of improvising in understaffed, under-resourced hospitals. She didn't panic. She calculated. The general groaned. Pressure. Just enough to keep you alive, Elena whispered, checking the intra-arterial line. Bleeds controlled, Or prep underway, you're going to make it. She turned back to the resident. Tranexamic acid. Administer 1 gram IV over 10 minutes. Watch for bradycardia. Crossmatch 2 units packed RBCs. Start as soon as lab confirms. Everything had to be precise. Seconds counted. Decisions couldn't wait for permission. Dr. Klein, Elena said finally, prepare the ventilator for surgical settings. Adjust tidal volume to 6 ml/kg predicted body weight. Maintain plateau pressure under 30 cm H2O. I don't want ARDS. Do you understand? Klein swallowed, nodded. His voice finally steady, he replied, yes, ma'am. Good, she said. And someone call radiology, portable ultrasound. We need to rule out pericardial tamponade. Do not wait for CT. Every command she gave was a calculated balance of risk and reward. Every word precise, every movement deliberate. Outside the trauma bay, the colonel whispered to the hospital administrator, who is she? She's the nurse they fired, someone said. The weight of the words hit Klein. He had overseen the dismissal. He had approved the humiliation. And now, in front of the general, his authority was irrelevant. Inside, Elena's calm competence was transforming panic into action. Blood was drawn, lines placed, fluids administered, bleeding contained, ventilation optimized. 10 minutes in, the general's vitals stabilized enough for safe or transfer. Prep or now, Elena ordered. Keep him warm, maintain MAP above 65, start norepinephrine titration. I want central line access first, prefer right internal jugular, ultrasound guidance, sterile technique, do not contaminate the field. Even Klein's most junior staff followed without hesitation. She didn't need a title, her skill was authority. By the time the general was wheeled into surgery, his blood pressure held, oxygenation adequate, heart rhythm stabilizing. Elena stepped back for a moment, finally exhaling. She didn't smile, she couldn't. There was more to do, and she knew it. But in that room, filled with elite doctors, military police, and surgeons, one thing was undeniable. The person who had been fired, humiliated, erased, was the only one capable of keeping the general alive. And everyone present felt it. Because in medicine, competence isn't polite, it's absolute. It commands respect, even from those who once claimed superiority. The ore doors swung shut behind them. Dr. Klein stood frozen in the hallway, hands clenched. For the first time, he wasn't the center of authority. Not in this room, not anywhere near the general. Elena didn't look at him. Her eyes scanned monitors, lines, and IVs. Every movement precise, every command deliberate. Prep blood warmer, crossmatch complete, she asked. Yes, ma'am, the blood tech responded, visibly trembling. Klein's face went pale. Am I to understand that? Step aside, doctor, Elena said, clipped professional. Or risk killing him. The words hit like a hammer, silence followed. Outside, the colonel whispered to the staff. You realize she's the one they fired. A young resident who had previously snickered at Elena's dismissal now swallowed hard. She saved his life before, he muttered. Every time, the nurse beside him added, she was right, we ignored her. Inside the OR, Elena assessed the subclavian bleed. This is slow arterial hemorrhage, she said. Clamp ready, pressure on the vessels, sterile drape in place, and someone prepped the thoracotomy kit as backup. A surgical fellow raised an eyebrow. You're suggesting we bypass protocol? Elena didn't blink. This isn't about protocol, it's about life. If we wait for paperwork, he dies. Are you competent enough to follow directions, or do I do this myself? The fellow nodded immediately. Klein stammered. But I am chief of medicine. The general groaned. And then, almost imperceptibly, nodded toward Elena. Power shifted. One by one, the staff who had once ignored, mocked, or dismissed her followed her instructions. Lines were inserted, blood replaced, ventilation optimized, pressure stabilized. Minutes later, the first big reversal hit. "Dr. Klein," Elena said calmly, "your permissions are revoked for this patient. You will assist where directed. Do you understand?" Klein blinked. Yes, ma'am." The staff around him suppressed smirks and stifled laughs. For the first time, the arrogant authority figure was publicly silenced. Second reversal. Elena instructed the resident to reposition the chest tube. Fifth intercostal, mid-axillary, sterile prep, clamps ready, suction 20 mmHg. Klein muttered corrections, but she shook her head. "You're wrong, stop arguing." The resident hesitated, then obeyed. The tube went in smoothly. The general's vitals improved immediately. Another reversal. A former colleague, who had publicly snickered at Elena's termination, approached the OR door. "Excuse me," he whispered. "Are you really?" "Focus on your patient," Elena said. "And watch, this is how competent nurses save lives." The young resident's jaw tightened. He understood now, those who mocked, those who humiliated were powerless. Respect was earned through courage and skill, not title. Elena paused, looking over the monitors. The general's oxygenation was steady, blood loss controlled, heart rhythm stabilizing. She turned to Klein. "Do you want me to explain why your protocols failed?" Klein opened his mouth, then shut it. He had nothing to say. Outside, the hospital administrator received a call. Reports of Klein's negligence and past incidents were suddenly under investigation. The walls he had built around himself were cracking. Inside, Elena gave the next command. "Prepare all for definitive repair, thoracotomy ready, rapid sequence induction, central line access first, internal jugular, ultrasound guidance." She didn't wait for approval. She didn't need it. The general's life depended on it. Another staff member whispered, "This is incredible, she's running the entire room." One by one, every arrogant voice that had once dominated her path was muted. One by one, respect returned, not from rank, but from undeniable competence. Klein's authority had collapsed. Elena's skill now commanded the room. And the most powerful reversal of all. The general, still weak, reached out his hand toward Elena. You're the one," he rasped. "I never forgot." Elena didn't take his hand immediately. She didn't need the gratitude. Her work wasn't over. But in that moment, she had reclaimed her power. She had proven beyond doubt that arrogance, rank, and ego could never outweigh skill, courage, and integrity. And everyone in that room knew it. No one in the OR noticed it at first. The doors slid shut, the general stabilized, the monitors humming steadily, but something in the building felt wrong. The phone on the nurse's station buzzed, unknown number, repeatedly. Elena ignored it. She had bigger battles. Then the alarms changed tone, sharp, piercing, different from the trauma alerts. "Security breach, facility lockdown initiated," a voice over the PA announced. Klein froze, his mouth opened, but no words came out. Elena's eyes narrowed. "Lockdown, who's in the hospital?" Colonel Reyes entered, urgency written across his face. "Ma'am, we've got intel. Someone's trying to sabotage the general's care. Could be a hit team, unknown affiliation." The room went silent. Even Klein stepped back. Elena took a deep breath. Years of battlefield training kicked in. She wasn't just a nurse, not tonight. She was a strategist, a survivor. "Prepare contingency OR, evac route for patient, every exit monitored," she said. "Security, sweep all corridors. We can't risk another infiltration." A surgical nurse whispered, "You mean someone wants to kill him?" Elena didn't answer. She moved back to the general. Prep for transfer. Maintain map above 65. Blood warmed. Central line secured. I want oxygen saturation constant, no drops. Klein tried to speak. This is outside. Step aside, Elena said, or help him die. Choice is yours. The first shock came 5 minutes later. A facility camera feed showed men in tactical gear moving toward the ore corridor. Armed, masked, unknown. Positions, Elena barked. Security teams surged in, but they were outnumbered. The intruders advanced, and panic rippled through the room. Elena assessed the options. They had the ore corridor, one secondary exit, and the ICU ramp. She mapped a path in seconds. We move him now, she said. Surgeons prep transport, anesthesia maintain airway, everyone else cover the door, no heroics, controlled extraction, follow my lead. Colonel Reyes nodded. Ma'am, you want to lead the extraction? Yes, move. The general, fragile but alert enough, was lifted onto a specialized stretcher. Lines and monitors clung like lifelines. Elena led the procession through sterile corridors. Gunmen appeared at the end. Security blocked them. Shots fired, alarms blared, machines beeped wildly. Elena didn't panic. She used body positioning, commands, and quick medical triage simultaneously. Keep pressure steady, tube secured, defibrillator ready, move now. Another reversal hit. Klein tried to intervene. Stop, you're endangering the patient. Elena looked at him. You endangered him every time you ignored protocol. Step aside. A flashbang detonated outside the OR. Smoke filled the hallway. Tunnel to service elevator, Elena commanded. Security followed. Surgeons, anesthesiologists, residents, even Klein reluctantly moved. The team descended 2 floors into the underground service elevator. The intruders tried to follow. Second reversal. Colonel Reyes radioed in. Threats neutralized, extraction corridor secure, full lockdown achieved. Third escalation. Elena realized Klein had tried to manipulate the hospital's internal security system. She's in command now, Colonel Reyes said quietly. Even he can't override her. The final stretch was chaotic. Smoke, alarms, shouting, gunfire outside, but inside the elevator and corridors, Elena maintained order. Monitor every line, she barked. Do not let map drop, keep airway patent, norepinephrine titrated, oxygen above 95%. At the ore prep bay, the general was safely transferred. Lines intact, vitals stable, blood replaced, airway perfect. Elena finally allowed herself to exhale. Everyone who had mocked her, humiliated her, and dismissed her authority now watched silently. The general looked at her, weak but conscious. You, he rasped. You saved me again. Elena shook her head. Not saved by luck, saved by preparation, skill, and staying calm under pressure. The storm outside was still raging. But inside the room, one undeniable truth had emerged. She was the only one capable of controlling the chaos. Even Klein had no choice but to acknowledge it publicly. For the first time in her career, humiliation had turned to undeniable authority. The storm of alarms and chaos finally subsided. The general lay stable on the OR table, lines intact, airway secured, vitals returning to normal. Elena finally allowed herself to step back. Her hands were steady, but her heart raced, not from fear, but from the gravity of what had just occurred. Dr. Klein sat in a corner of the room, shoulders slumped. The air was heavy with silence. Colonel Reyes approached him. Dr. Klein, you're under investigation for negligence, protocol violation, and multiple cover-ups. You will cooperate fully. Klein's mouth opened and closed. No words came. For the first time in years, he had no authority. The hospital board convened within hours. Reports of Klein's mishandling, falsified patient charts, and prior infractions came to light. Within 24 hours, he was suspended pending a full federal inquiry. Outside, news vans began to line the streets. The story of the nurse who was fired but saved a general's life went viral internally first, then leaked to mainstream press. Inside, the general stirred, his eyes focused on Alina. You're the one," he rasped. "You didn't just save me, you corrected everything I trusted others to do." Alina shook her head. "I did my job, sir, always have, always will." He reached out, grasping her hand, weak but deliberate. "You should never have been fired, you should have been recognized, I will fix that." And he did. Within days, Alina's medical license was fully restored. Her termination record expunged. She was offered the position to lead emergency response training for the military and civilian hospitals nationwide. Former colleagues who had mocked her were publicly reminded of her skill, humility, and courage. Yet Alina accepted none of the pomp for herself. She requested one condition: no one should be punished for doing the right thing. Because this wasn't about revenge. It was about justice, competence, courage, integrity. Klein's downfall was not just public humiliation, it was a systemic correction. Protocols were reviewed, staff retrained, patients who had been put at risk under his leadership were reviewed for proper care. Alina didn't gloat, she didn't need to. Respect, once earned, cannot be taken back. And finally, the professional world acknowledged it. In a quiet hallway later, the general and Alina stood together, outside the chaos, away from cameras. "You could have walked away forever," he said. "But you came back." Alina smiled faintly. "I couldn't. Some things can't be ignored. Some lives can't be left to chance." The moral was undeniable. True power doesn't come from a title, rank, or ego. It comes from competence, courage, and the courage to stand for what's right, even when the world tells you otherwise. As she walked out of the OR, the staff lined the hallway, silent, nodding, eyes full of respect. The same people who had once mocked her now understood what respect really meant. The general gave a final salute. Alina returned it, not for him, but for herself. And outside, the sun broke through the clouds over the city, a subtle reminder that justice, like daylight, eventually returns. What would you have done in her place? Could you have walked away or stood your ground, even when everyone told you were wrong? Because sometimes the right choice isn't the easy one, but it's the one that defines you.